can you tell the people about malaria and today's event, World Malaria Day, marked across the world?
Today, generally, we are celebrating the Malaria Day. Malaria is a disease condition that presents with fever, that is, increase in temperature, when somebody is feeling weak or tired, non-specific symptoms, you're just feeling lazy, you're just feeling tired unnecessarily, that's what we call malaise. And when somebody is also having nausea, not wanting to eat, when you are having you just don't have appetite. That's how some people call it when they come for presentation. They will say, I don't have appetite. So you just start feeling tired. You just don't feel like eating. You just don't feel like doing anything. So you start getting weak gradually. And some people present also with abdominal pain, depending on severity or how long it has stayed. People can get to have abdominal pain, and because they are not eating, they will think, oh, it's because I've not been eating, it's because I've been hungry for longer. Then they come to the hospital, oh, I'm having abdominal pain. After that, in children, we can have diarrhea. We can have vomiting. Those are all abdominal symptoms. Starting from the nausea version, where they start rejecting food, even the food that they love starts getting irritating to them. They start rejecting food. From there, they start having abdominal pain. From there, they might start vomiting. From there, they can start having diarrhea. So those abdominal symptoms are more common in children compared with adults. But we've had cases of adult men presenting with these symptoms as well, having diarrhea, stooling and vomiting. So those are common symptoms. Now, if left for even longer, the red blood cells in the body, the parasites, they will start breaking it down. So the person will start losing blood. This is another common presentation in children, where their blood level will become very low, 16%, 12%, 8%, and even in severe, very severe cases, we've had 4%. Yeah, the child is already going, isn't it? So those are common presentation in our climb.
Indeed, you've mentioned lots of different symptoms and ways that malaria presents itself in different people.
Yes.
And now, doctor, in what you said, sometimes we experience that someone has a serious cold, cold feelings. Then before it turns to a feverish condition,
Yes.
And then you go to hospital and they diagnose the person and they will say the person has malaria. What's the connection between cold and malaria?
Okay, thank you very much. This is one of the reasons why we have fever, increase in temperature. Now, chills and rigor is what you are trying to describe, where somebody is just feeling cold, trying to wear thick clothing, and also covering his or her body with duvet or cover clothes. These are common symptoms, again, how people feel. It's because the body is trying to raise the temperature of the brain. It's trying to raise the temperature of the body. So as the brain is working on increasing the body temperature, the body is feeling like I'm cold, even though the body is at a normal temperature. But because the brain is telling the body that your temperature is not normal, we want to kill some microorganism. We want to kill some parasites in this body. So we have to increase the temperature so that those parasites, those organisms will not feel comfortable in this body. That because the body now wants to generate it, our muscle will start shaking. We start shaking, we start having chills, we start having rigor. Rigor is when we are shaking. So those are the pathophysiology for the fever.
Okay, so we can say that when malaria actually comes, it can present itself in any other possible way.
Yes, depending on the person's capacity or the person's immune system.
Okay, so let's talk about the causes of malaria. Do we have just a major cause of malaria as mosquito bite, or are there some other possible causes of malaria? Why do we always emphasize only that of mosquitoes? I know also we talk about dirty environment, maybe accumulated bad water and all that. So can you tell us more about the causes of malaria?
Okay, thank you very much. Malaria is caused by a parasite. We call it Plasmodium falciparum, depending on the environment, depending on location. That is the cause. They are all Plasmodium. They are a group of organisms, Plasmodium. We have different types of them. I think 4 or 5 groups: Plasmodium malariae, Plasmodium falciparum, and the likes. However, this plasmodium organism or the parasite can only be spread by female Anopheles mosquitoes. So the mosquito is now let's say, the organism that spread the infection. This is the reason why all focus is on the mosquito, because without the mosquito, there will be no spread and there will be no malaria for the people. So when we are now talking about how to prevent malaria, the causes of malaria, we focus so much on the mosquito. And why are we focusing so much on the mosquito? It's because mosquito is prevalent in our environment. And like you said, the reason why they are now prevalent in our environment is because our environment is favorable for their growth, starting from lodging water that is not moving, to dirty gutter, to a lot of grasses and anything that can store water. Because these organisms, they love to live and reproduce and produce eggs where there are static water that is not moving. So we can have static water on leaves, we can have them between grasses, we can have them in the bush if your environment is bushy, and we can have them in a dirty gutter. Dirty gutter obviously will not be moving. If it's moving, it will be slow because of all those dirts that are blocking the gutter. So dirty gutter host or accept the procreation of these organisms or of these flies. Now, we talk about dirty environment, not having net that can prevent mosquito from entering your house. When you don't have net on the windows, net on the doors, obviously the flies, they can easily go in and come out. Especially if you have children, babies in the house, we always advise that you have nets. Then within the house, you should have insecticide-treated nets. Not just ordinary nets, because as you are going out to go and urinate and coming back to sleep, any flies can follow you inside the net. But if it's an insecticide treated net, it will be difficult for the flies to go inside the net and survive. So these are the reasons why we focus so much on the flies. That's the mosquito itself.
About keeping the environment clean is to make sure that we terminate the existence of mosquito from around us.
Yes.
Okay, thank you very much. Now, that time, malaria had really been a very serious sickness, to the extent that it was really a death sentence.
Yes.
I don't think we can talk of malaria today again as a death sentence.
Yes, we can. Children are still dying every day from malaria. 2 days ago, somebody still put a message in asking for support, asking for help. The child has 8%. And they are trying to raise funds for blood transfusion. Unfortunately, he's not in Ibadan. We are in Ibadan. We can say, okay, we can help the child without even having to collect any money. But they are not in Ibadan. There's really nothing much we can do. So we just advise that, if you have any brother or sister that can do blood donation, it will significantly reduce the cost of blood transfusion for the child. So every day you will still see people in the local environment, people that are struggling even to eat, not to talk of treating diseases or infection in their children. Those are the real reasons. Late presentation, because of lack of funds, because of poverty, it affects children a lot. So up until 2025, now that we are talking, malaria is still a death sentence when not treated.
To mark World Malaria Day today, what's your advice to our listener right now as they listen to you on ways to prevent the act of malaria in their body?
My advice to everybody listening is to seek information and present early to the hospitals. Like we are saying, the problem is not that there's no support. The problem is not that there's no help. In fact, in some private primary health care centers, malaria treatment is free. So it's because people did not know, or they keep the child at home. We call that neglect. When you don't pay attention to the symptoms that your child is presenting with, that's child neglect. The child is already weak, tired, the child is not eating well. Take that child to the nearest primary health care center. You will be surprised that they will do testing and they will give you medication for free. It's not something that is hidden. Almost all primary health care centers treat children for free. So if you present early, immediately you notice fever or increase in temperature in your child, you won't even have to struggle at all. I am for prevention. I am big on prevention. I believe that anything that we pay attention to early, we will spend less. For instance, if you know that your body is not feeling good today, you're having body pains, you're having in the evening, chills and rigors are common in the evening. You get home from work in the evening, you started feeling cold. You started feeling yourself that you are not as active as you used to be. Get treated immediately. Because of the fact that we know that it's a common problem in our environment because of mosquito, so the first thing to do, and we always talk about common things occur commonly. So any feeling at all, any unnecessary feeling that you are having that is not normal, loss of interest in pleasurable activities, loss of interest in food that you love, immediately go and treat malaria. You might not even spend 2,000 at that point. But when you leave it and you continue to struggle and continue to work yourself hard, then you will spend more. But for children and probably younger adolescents, take them to the nearest primary health care center and get them treated. It's going to be free. Most places, it's free. So I'm telling everybody now that present early to prevent unnecessary spending. That money that you are saying you don't have, the poverty that you said is the reason why you are not presenting, will eventually cost you more, and hopefully it will not cost lives. So let's present early. Let's make sure that we clean our house. Our house is not harboring mosquitoes. Let's ensure that the gutters around us are neat, well clean. People really, they are trying a lot in that area. So let's ensure our environment is clean. Let's ensure that we have nets on the windows and on the doors, and malaria will be thing of the past. Thank you so much.
Dr. Adepoju, thank you so much for honoring the invitation, obliging us this opportunity to talk with you, and of course to inform our team listener out there. She actually gave us this opportunity to talk with her. We quite appreciate.
No
and
problem.
Hope that next time when we call you, still oblige us. Thank you so much, ma'am.
No problem. Thank you so much. Have a good
Right,
day.
all right. Okay, you too, ma. Bye.
Yeah, bye.
Okay, ma. All right. So